This is Dr. Magarelli. Welcome. Welcome to our CNY Live in Search of the Stork with Dr. Magarelli here at CNY Colorado. Welcome. Hello, KF Love. Good to see you. Mrs. Elaine Lynette. Hello, how are you? Mama Bear, welcome. Meet Deese. Good for you. Hello. Let me see who's on our, today we're going to be doing questions and answers, so everything will be on the Instagram. Love the little kisses. Hello, everybody. Hi, Sierra. Hi, Full Winter Joy. I love it. I don't know if anybody's happening here on we are live on Facebook and YouTube. Hey, hi, that small one. Hello, Evix Martirez, making a young gone. Scorpio baby, there you go. Hello, Trish O'Hare. Good to see you on the Facebook Live YouTube stream. Phenomenal Queen, welcome. Hello, everybody. Love the hearts, love the kisses. Good to see you all. It's actually a kind of a nice day here in Colorado. It was extremely cold this morning, and then it got nice and warm. Okay, we're going to do questions, okay? What is the protocol if I have PCOS? But I'll be carrying her eggs and she doesn't have any known fertility issues. Protocol for what, my dear? So you want reciprocal IVF. That means you're going to do your eggs and your wife's uterus, or your uterus and your wife's eggs, whatever works. There's no particular, because you have PCOS, impact on your wife, okay? Hello, Shaw Queen. Nice to see you. Regarding Hcg wash, at Retrieval, I was at 3,500. Does it make sense to do a wash for fresh? I don't know what that means, Mono Monet. Well, what lab should I request to have done to help be proactive to avoid a pregnancy loss? Well, download our family building guide. Hey, Hallie Kavanaugh, happy Tuesday. Download our family building guide, which you can find at the CNY Fertility website under resources. It has the vitamins, it has acupuncture, it has Vital, it has lifestyle, which is low carb. Egg retrieval yesterday, 16 eggs, only 4 mature, 2 fertilized. What's the issue here? It depends on your age. So if you have, if you are, again, it depends on your eggs. So give me a little more information. No, I'm saying I have PCOS, but I'll be doing reciprocal IVF with her eggs. She doesn't have PCOS, but that doesn't matter, is what my point was. You're having PCOS does not affect your partner's transfer. What do you recommend for a failed transfer? I have blocked tubes and I have previous multiple miscarriages. Well, you need a recurrent, this is Lohana. You need what's called a recurrent pregnancy loss evaluation. You have to look at the uterus. You have to look for infectious agents. You have to look at endometrial agents. You have to look at immunologic agents. Look at your diet, lifestyle, alcohol, tobacco, drugs, of course, increase the risk for miscarriages. I am 30. I asked the issue about having 16 eggs, only 4 mature. Well, it may be that you could have grown a few more days and found that you got more mature eggs. But again, that has to be balanced with whether or not you were hyperstimulating. So that could be an explanation. Hey, Chris Parasoto, nice to see you. Kelly, how do you get rid of fluid in the cervix? In the cervix before transfer, or in the uterus? I think you mean in the uterus. Well, you really can't get rid of it. It may be that there's an issue with the endometrial lining. It may be simply mucus, which is fine. It tends to go away when you add progesterone as you get closer to the transfer. Can I transfer 2 embryos? Well, the American Society for Reproductive Medicine recommends 1, and we kind of follow that as best we can. What is the best protocol for patients with endometriosis and endometriomas? Well, depending on how big they are, you may need surgery. What are the benefits of going through CNY versus other IVF clinics in Colorado? Sierra Cloud, don't know. That's something you'll have to figure that out. I mean, we definitely are a low-cost option, or a lower-cost option. We're one of the largest IVF centers, so we have a lot of resources. Yeah, I mean, if you like the docs and like the folks here, I think that would be a good reason. Hello, Grace. Nice to see you. I had my HSG yesterday that showed 2 small polyps. IVF is scheduled for January. Should I retrieve first? Yes. And remove polyps secondarily? Yes, absolutely. Erica, make embryos, make everybody, make embryos, make embryos. You're welcome, Sierra. Make embryos, make embryos. That's the thing I tell everybody. Tasha, I just found out I'm pregnant. My TSH is 5. Is 50 milligrams of levothyroxine enough dose? No. So call your doctor and they can adjust your dose. Is Atlanta doing monitoring, transfers, and retrievals? Not at all. They do monitoring, but they don't do transfers and retrievals. Okay, Heather, good afternoon. What can I do to get more of my follicles to mature at the time of retrieval? I had 9 at baseline, but 5 matured at retrieval, or is that really good outcome? Injections were, yes, that's a really good outcome, Heather. Yes. I have done all the tests, including checking tubes and ovaries, and have a regular cycle and interested in having IVF with donor sperm. Hard to find an appointment. January, got February. Okay, that's a fact, right? It took you hard to get an appointment. What protocol, but always put yourself on the waiting list, okay? Staying on the same protocol, are there improvements observed in back-to-back cycles? Oh, I know Kat is Ninja. I know her. I know you, Kat. Okay. Kat Isa Ninja. That's right. Back-to-back is the way to go, but you might want to get an adjustment in the protocol. But yes, back-to-back is the way to go. Hello, Lindsay loves hair. That sounds nice. Hi, Kat. Honest Jazz joined. Hello, Ms. Buzko. Nice. Hi. Let's see. Okay. Ask some questions. Can ovarian cysts cause a lower fertility, that small one? Yes. Sometimes if the cysts are large enough, what they can do is compress the ovaries and may keep you from getting good blood flow, which in turn will reduce the number of eggs that are available. So, yes, it can. Not typically, but yes, it can. Does CNY do embryo donation? Yes, we do. Pretty much everything that's out there, CNY does. Pretty much. Yum. Okay. Hello, Honest Jaws. Thanks for the waiting. And Harris, Lenka, hello. What tests do you guys do that determine the medication list? Well, that's your AMH. Will help us understand at your age. Those are the way we do that. What protocol should I do? I have had 4 miscarriages. All my tests were normal. Well, IVF with PGTA would be one way I would do it. So IVF with PGTA. Approximately how many days past cycle day 1 is the frozen embryo transfer? About 17 to 19. Shosh Queen, I started the diet already. Yay, good for you. Low carb is good. Does acupuncture improve medication response, oocyte quality, or both? Well, Kat, there's actually some data which suggests that it absolutely does, or actually it does, reduce the need for certain medications, expensive ones. And then, yes, if pregnancy rates and improved pregnancy rates and lowered miscarriage rates are an indication of oocyte quality, then the answer is yes, it helps both. How many transfers are included in the CNY IVF program? 1. 1 is included, and then you do another one. Can fully blocked tubes be unblocked? Not necessarily. I don't think that data is very good, and plus it leads to ectopic pregnancies, so it's not the way I would go. I had a hysteroscopy last November, a failed transfer this October. Do I need to do it along with the lap? I would. I have black tubes, Johanna. And yes, Vanessa's back telling us to join the CNY fertility support groups. She's sent the message on Facebook. It's on Facebook groups. Hello, the journey through IVF. We adopted a kitten and named her Maggie for Magarelli because she loves kisses. Oh, God. Oh, God. That's wonderful. That's so sweet. Thank you. Thank you. How long would CNY recommend after a vertical C-section to transfer again? Well, I'm assuming you're breastfeeding, so it's going to be 18 months, right? Have you heard of progesterone sensitivity? I had my last FET, got some kisses coming. Oh, I missed that one. I have blocked tubes and 2 failed transfers. Do you recommend getting my tubes removed? Only if they have fluid in them. They have a hydrosalpinx. Just because they're blocked, I would not. Hey, Vanessa. Good to see you, my dear. Bless everybody. Vanessa is really supporting us. Hey, Joshuaman. There's my dear Dr. Banerjee. He's going to come out to Colorado next week. We're really looking forward to it. Make sure I have all the dates that you're coming out. And then Dr. Banerjee is going to help us next year, which we really appreciate when Dr. Fink and I are on two different coasts doing two different things. He's going to help. All righty. After having an ectopic and losing my right tube, would you recommend IVF or IUI is still an option? Well, Shay, if you have a tube that's functional, it's an option, but it's your age, your AMH, it's your history, it's how fast, how many children you want. There's not an answer to what you should do. It's what are your needs and how do we meet them? That's really what it is. What locations do retrievals and transfers? Well, the Colorado Springs does. Syracuse, Albany, Buffalo does, and then Rochester does some. How does fluid in your tube affect IVF? Well, fluid in the tube can poison the environment inside the uterus when the embryo is transferred. So if that fluid leaks back in, that's definitely not a good thing. Definitely not a good thing. Oh, let's see what's happening here. Is anybody there on the Facebook Live side or the YouTube side? I don't see any questions there. Hello, Healthy Fit Nutrition. Welcome. Christy09. There you go. Okay. Lori Jones. With another clinic, I went through 2 cycles of IVF with no response to the medication. So I never had a retrieval. If I go to CNY, if the retrieval doesn't work, would you change it going through another cycle? Absolutely. I mean, that's the one thing about CNY is we really personalize. I mean, we really do, which makes it kind of hard sometimes, but we really personalize our way of treating folks. Would it be okay to do a transfer after having a laparoscopy done and a tube removed with my cycle after surgery, or should I wait 2 cycles? 2 cycles, Ashley. You got to repair. How long? Oops, going by too fast now. 42 years young, good. Doing IVF in Albany. Would you recommend PGT or no? No. A fresh transfer day 3. Dre MPA. Do you suggest Lupron depot shot for endometriosis if a patient had a bad side effect from the shot? No. If you had a side effect from the shot, I wouldn't do it. Can CNY remove a tube? Yes, we can. We have surgeons. We certainly have surgeons. My pleasure. Okay, KTS Joy with a couple of kisses. I got some kisses. Thank you. All righty. Or Rainbow Road. Here we go. Hi. Again, Vanessa is recommend that you guys join the CNY Fertility Support Group. I'm Dr. Magarelli, of course, from CNY Colorado, along with my colleagues, Dr. Fink, and then my 2 acupuncturists who work alongside us is Dr. Stephanie King and Dr. Diane Credenda. Kay Kwok, we appreciate all you do for us. Well, I appreciate you guys. Hey, I sure am, Vanilla. I'd have to see a picture. Okay. Can I do an FET only at CNY? Yes. If you have embryos that you want transferred, yes, we are happy to help. We are happy to help. Kat, do you recommend an ERA before a first transfer, only if a transfer fails? Kat, I tend to think that's a good tool if it fails. But if you only have 1 chromosomally normal embryo, then do it before. Currently, the medicated FET cycle, the estrogen and prednisone seem to make me very nauseous. Any advice to manage this? Well, ask them to check your estrogen level. It might be too high. That can create some nausea. Would you recommend fresh or frozen transfer if the issue is sperm morphology? Actually, I just am reviewing a paper where fresh and frozen transfer are the same. There are times when one works better than the other, but honestly, overall, it's what works best for you. So either one is fine. Does weight affect IVF? Should I work to lose weight before attempting IVF again? Do you recommend a certain BMI? No, we don't, Lori. We don't recommend a certain BMI. Just be human. We're not big ones for pushing weight loss. I think time is more important than weight. So the shorter the time, the better. Okay. Shosh Queen, I have all the reports from previous tests. Do I still have to go through all the tests before IVF? Well, it depends on if they're current. Melvin, Portillo, how long can we expect to be on low monoxin progesterone and oil after a positive test? Well, probably, 8 to 10 weeks at least, I would think. Have you heard of progesterone sensitivity? Yes, I had this in my last FET cycle. It's like an allergic reaction. Will this affect implantation or progesterone dosing? Yes. So you want to do, I'm guessing you had that reaction for injectable fertility medicines, not the vaginal. So go with the vaginal. That's really where you want to go, because there are some people who are not really allergic to the progesterone, but they're allergic to the progesterone and oil. So I would recommend you look at that. Okay. Black Artemis, hello, you joined us. Righty. All righty. What kind of question? What kind of things? Well, everybody knows about Kiltz's keto, right? Dr. Kiltz's keto. Dr. Kiltz, I think, is drkiltz.com. He's certainly doing a lot of work on advancing our understanding of how nutrition and lifestyle impacts us. So definitely check that out. Okay, the journey through IVF. Laparoscopy this Thursday, yay. Next IVF at Colorado in January, yay. What are some holistic recommendations other than acupuncture, yoga, and diet recommendations? Don't know the answer to that. Yes, bought the book. Good. You're purposely ignoring my question. I'm watching you overlook some of us. I'm not quite sure, Meet. This is, I think I've kind of answered a half a dozen of your questions. I'm not overlooking anything. I try to do as many as I can, but they come by pretty quickly. Heather Page, hello. Nice to see you. So Meet Desses, what's your question? I'm not sure which one that is. I have to have a surrogate carry for me. Does CNY work with? Yes, we do. We work with GCs. We use just the term gestational carrier. This is a person who'll carry for you. We have a whole part of our organization, a third-party organization, that's will be helpful to you. Okay. Not a lot of questions. Throw me some questions. Can you discuss a little about slight endometriosis after a laparoscopy and how it affects a transfer? Okay, yes, Ashley, endometriosis is just the lining of the uterus on the wrong part of the body, usually the peritoneal lining of the inside of your body. You get these little blebs of endometriosis, and they can cause an inflammation. They could also cause some scar tissue. They can cause some obstruction. So there's lots of things it can do to interfere with pregnancy. Now, a good choice for people with endometriosis is to do IVF because you get around the peritoneal cavity. It's not perfect, but it does get around the peritoneal cavity. So you can sort of sidestep some of those issues, and we tend to see better, more success. So Baby Doll 36, welcome. Amersul, welcome. Okay, Heather, I'm trying to get my nerve up to start my Omnitrope tonight. It is my first time giving myself a shot. They're small. They're okay. You'll be fine. Just you try it once. You'll be fine. Shanda, what could be reasons for abnormal embryos if eggs were mature and fertilized normally? Age, number one reason. What are your thoughts on Hcg boosters, Charon? Well, I tend to think that they have a historic use, but I'm not quite sure how they affect current pregnancies. You can choose the vaginal progesterone instead of the oil, yes. Meet Desses, which I did answer that question before. So the Hcg boosters are really there to get your ovary, because it acts like LH, to produce progesterone. Well, we give you progesterone. Yamajorka, if I use donor eggs, will the baby have any of my DNA? No, but your DNA, your personhood, will affect how that baby's DNA is expressed. It's called epigenetics. Fascinating topic. Black Artemis, I'm using a donor at CNY, and the nurse said they haven't called yet when their first. Okay, it goes by to, can you transfer PGT testing with fresh transfer? No. I started Omnitrope last Friday. I too was so scared to give myself a shot. First time I stuck in and panicked and pulled it out. But then it did fine. Thank you. That's help. Let's see. I have slight endo with a damaged tube and a lap done in April. Have another this month and getting my tube removed. Can I do anything else vitamin-wise or anything that can make a transfer work? Well, look at our family building guide, which you can find at CNYfertility.com resource page. And there's lots of ideas about acupuncture, serovital, growth hormone, low-carb eating, avoid alcohol, tobacco, drugs. KTS Joy, my husband is having a teaser at the end of the month. We are praying for some healthy sperm, hopefully to start IVF in the 22nd. What can we do to prepare? Family building guide, family building guide. Download our family building guide. Avoid alcohol, tobacco, drugs. Acupuncture is useful. Low carb eating. Take the nutraceuticals that are recommended in the family building guide. It starts with an egg, has lots of ideas. Go to our website. There's an enormous amount of information there on things that can help. So yeah, that's another place. Welcome, Embrace Vida, Embrace Life. There you go. And Jackie Comey, John, welcome, welcome. How many PGT normal embryos do you recommend banking for a healthy child at 42? Well, you need 3 chromosomally normal embryos to have a greater than 80 to 85% chance of success at your age. So you want about 3. That would be a good idea. Sarah, if doing a new stim cycle and have frozen teaser, do you typically recommend fertilizing with fresh and frozen sample? Just the fresh if you can get it. What are my thoughts on Hcg boosters? I already said that. Okay. All righty. Hello, Wave. I finally had my laparoscopy done after 2 failed transfers and found out my tubes were completely closed and had them cut. Do I have a better chance now? Well, I'm assuming they did more than that. They probably found endometriosis, and you should have a better chance. Honest Jaws, would you recommend 2 embryo transfers at once? No. How many PG? Oh, I already answered that one. Yeah, completely closed. So that's interesting, Marisette. But well, if your tubes are closed, and of course, I'm assuming, Marisette, you're doing IVF, right? And that'll, of course, enhance your chances. Shanika joined. Hello, Shanika. Okay. Should I remain on Omnitrope until retrieval, or would 3 to 4 weeks be okay? 3 to 4 weeks would be great, Heather. Yeah, 3 to 4 weeks would be great. If you can remain on to, if you can remain on the growth hormone, that would be great. Would you recommend going through a surgery for fibroid removal before attempting an FET? Aku. Well, I would ensure that the fibroid is influencing the inside of the uterus. If it's not, then don't do the surgery. I don't think that's a good idea. Okay. Okay, you just did my egg retrieval. I got 3-day 5 blasts. Good for you. Not graded. Okay, why should they not grade those? Oh, I have no idea. Which should I transfer with you next month? And should I one more? Well, okay. Okay, I don't grade. We do that based on patient need, but it doesn't have any information that helps us understand anything about you. So don't worry about the gradings. If you have a viable embryo, that viable embryo has a much better chance of making a baby inside you than in the garbage. Because what else are we going to do? These are the ones you made. I'm not sure this issue of grading on day 6 or 7. I'm not sure what that is. But yeah, don't worry about the grades. You are, I don't know how young you are, Sarah. If transferring into CNY, can you get frozen teaser from another facility? Sure you can. Can you explain why 2 embryos transferred is not recommended? The main reason, of course, is multiple pregnancies. We've put in 1 embryo and gotten 3 babies, 2 embryo and gotten 8 babies. Not a good question. Shanika, I have a question on the pre-implantation testing of embryos. Do you require to do it? You are not required to do it. So you're 35, yeah, and you have how many? I got 5 blasts. Wait a second, I got three-day 5 blasts, and 2-day 6, and a day 7. So that's a lot. I think you have enough to start a family there. What's the best advice for people getting ready to start IVF? Vitamins. What's best, female and male? Well, Tiffany Farmer Mobley, download our family building guide, and it's 122 pages, well designed, which will explain all the wonderful things you can do to help achieve a pregnancy. Now, acupuncture, I certainly support. Done a lot of research. Do you need the COVID vaccine before IVF? It's not that you need it, we just recommend it. Rosin, always having a leading follicle. What shall I do? Tried priming with estrogen and progesterone, but my levels got higher. Well, Rosin, then you just ignore the one lead and hopefully you have enough other ones. We certainly can do that. So that's an option there. Are hot flashes a side effect of fertility medicine? Certainly a side effect of Clomid. Would you recommend a mini IVF for age 37 with an AMH of 0.4 if first cycle resulted in abnormal embryos? No. Shonda, the presence of abnormal embryos is not based on the protocol. It's based on your age. Yes, if your AMH is very low, a lower dose was almost as good as a higher dose medicine, and you save a lot of money. So that's the reason for the mini, is to save money. No other reason. It's not more efficient. It's not better. Just saves a little bit of money. Bought the family building guide. It's worth it. So much info that other RT clinics withheld. Well, thank you, Journey Through IVF. Yes, you don't have to. By the way, you can buy the family building guide on Amazon, or you could download it for free and on CNYfertility.com resource page. Okay, you can definitely do that. Me and my husband planning IVF, but he needs to go through a TISA. Do you know how successful would the TISA surgery be, Shanika? Well, if the reason for the needing a TISA is because he had a vasectomy, it's better than 98% chance they'll find sperm. Hi, Sarah. Yeah, please don't worry about the grading. I have seen the poorly graded embryos make babies and absolutely perfect embryos not make babies. We know that from our genetic studies now with PGT that the grading is not that accurate. So yes, feel better, Sarah. We'll make a baby. Okay, from Just Us came S. Mosby came. Hello, nice to see you. Glad you joined us. Let's see, how are we doing? I seem to be on top of these questions today, which is good. Yeah, I have to come up with an analogy for you folks on grading. It's like, yeah, what is really, the grading is so hard. It's just not, it's arbitrary and it's not very accurate. Amy, how soon after delivering a baby via C-section can I start the IVF process? Well, I'm assuming you're breastfeeding. I think I answered this already. And then, so 18 months, right? Or at least 9 months. You could start at any time, of course, but that's what we recommend. To Shonda, what size follicles are good for IUI? Anything above an 18 millimeter, closer to a 20 millimeter mean diameter follicle. At 43, should I do fresh or frozen, Heather? Fresh transfer, day 3, fresh transfer. Definitely worth it. The embryo in the uterus is way better than letting it grow and not grow. I don't see any reason why not to put it in. I think a lot of clinics don't put it in because they're competing for pregnancy rates, but that's not something we do. Rosin, stemmed for 2 times with gonal left. I got 2 embryos. 1 time stem with gonal left 450 and got 2 embryos. Which protocol to do this time? Well, you're getting older, so the more medicine probably will be helpful. Does CNY support reproductive immunology? I don't know what that means. Do we support it? We do a lot of work with it, but I'm not quite sure what supported means. Just saying hi. You did my retrieval today. I was the one that couldn't find a vein. Oh, you were so wonderful, Rowie. You were absolutely brave and wonderful. Getting all those sticks. Oh my God, you were wonderful. And good luck. Okay, we'll talk to you tomorrow. Sarah, do you usually do day 3 or day 5 transfer? Sarah, it's kind of even now. In the old days, I would only do day 5s. I really did in freeze-alls. But now I've learned that, day 3s make lots and lots of babies, and fresh make lots and lots of babies. So, yeah, as even this old dog can learn new tricks. So, yep, I'm do day 3s, day 5s, probably 50-50 is my guess. I had a submucosal fiber removed and was told I am an automatic C-section. Well, that's Sarah Griswold. That's probably because of the extent of the surgery. Nothing to do with a surgery, but they know, your surgeon knows whether or not the uterus was compromised. On a cancellation list, have a consult in February. Alex Ratchford. Good. Glad. Is birth control required prior to starting an IVF cycle? Nope. Floss Mosbanka joined. Pushachi joined. All these nice names. Okay. Melissa joined. Hello, Melissa McIntyre. Hi. All right. Ask some questions, Carmel Kiss. Ask some questions, Melissa. You guys ask all those questions you're holding on to. Should a patient still go for IVF with oneg when over 40 and low AMH? Of course. If you want to use your eggs to make a baby, that's the way you're going to make it, right? Is going to be doing it through IVF. So nothing wrong with that. Nothing wrong with that. Absolutely. That's the one thing about CNY we're very proud of. We don't turn people away for any reason, pretty much. What can I take for pain before my Sailing Sonogram this Friday? Any kind of ibuprofen, Motrin. Jalen, I've been getting nosebleeds daily. Could this be caused by my fertility medicine? Is a cause for concern? No, it's probably the dryness. Low morphology only with IVF? Yes, you have very low morphology. IVF is recommended. Heather, I was on immune. Everybody's asking questions. I was on immune protocol 2, planning to do a transfer next cycle, was having racing heart and prednisone. Anything I could take in place? Just don't take the prednisone. You'll be fine. Maria had bad results with back-to-back retrieval, good results with priming with estrase and endometrium. Can I prime for 2 weeks right after retrieval, or do I need to skip a cycle? The real priming is skipping a cycle. Okay, if doing gender selection and embryos can produce multiples, how can you guarantee a specific gender? That doesn't make any sense because, I see what you mean. No, if you're doing gender selection, we're only putting in boy or girl embryos. So that's all you can get is boy or girl embryos. Heather, I do not have PCOS. Is it okay to take myo-inositol? Absolutely. I heard it can mess with your cycle. It does balance the hormones. Why does the prednisone help? It's an immune suppressant. So that's why it helps. But again, not many of us we're not sure, have immune issues. I'm over 35 and curious about PGT. Is the cost? Well, the 35 to 40-year-olds, believe it or not, are the ones most affected and helped with the PGTA. So you might want to consider it, but you don't have to. You're going to put your embryos in, so you don't have to. You're welcome. Coffee and tie. Okay. All right. Any benefits to IUI versus timed intercourse? PCOS husband's semen analysis was perfect. First and foremost, there are no perfect semen analyses. There's only normal and abnormal. I don't like the judgments, perfect, great, super, duper. That kind of makes you feel bad. There's no such thing. Well, Ashwald, if you've tried 11 months with intercourse, then I would do IUI. Do you recommend multiple embryos to be transferred? Nope. Shanika, you're welcome. We don't recommend multiple embryo transfers because of all of the potential of the babies and the multiples and the risk to mom. Magdalena, should I have my fibroids removed before having another IVF? Do you think it will be more successful? I just had one failed cycle. Do you think the fibroids could have been the cause? Well, if the fibroids were in the uterine lining, then absolutely. If not, not so sure. All right, 2-day transfer. How long should I wait before I start testing at home? After a 2-day transfer, You shouldn't be testing at home. Wait the 10 days, get a blood test because they're not that accurate. Heather, what is better, CoQ10 or ubiquinol? Doesn't matter. Lydia, how do you feel about transferring to a homogeneous lining? Well, we always transfer to a homogeneous lining because once you start the progesterone, it creates a homogeneous lining. Now, if the homogeneous lining is prior to the use of progesterone, then, there may be an issue with that. Although it's not, I would say that you would prefer a trilamina before you start your progesterone. Mm-hmm. Hello, Spicer Tanya. Nice to see you. All right. Questions go fast and then they go slow. Okay. The Barges family joined. Welcome. Welcome. Where is everybody? I'm Dr. Magarelli out of here in Colorado. Dr. Fink is my partner out here. We've got a new, very proud to say we have a new nurse practitioner. Shout out to Brandis. Welcome, Brandis. She's going to be amazing. Asked lots of great questions. We've got 3 new nurses starting up, which is fantastic. We got all kinds of help from CNY, which is great. Oh, you love CNY. I love CNY. That's great. What else is new? Lyric joined. Hello, Lyric. Is it costly to remove fibroids if you find any blockers on saline? Well, if the uterus is normal, the uterus is normal. Don't do anything about it. After a failed transfer, is it recommended to move forward with another as soon as possible? Honest job. Well, it's not as soon as possible. Let's make sure we understand why it happened. You might consider doing an endometrial receptivity assay, an ER peak. Lydia, I am rechecking in 2 days. Could my lining change to trilaminar? Yes. That quickly? Yes. Sarah, should I stay on my prednisone, metformin, and LDN until my FET with you next month? My prednisone, yeah, I think so. Sarah, I think so. That would be fine. But call the nurses. Make sure that make sure you know your protocol. Don't just stay on stuff. Everybody, by the way, you should know every day what you're supposed to do and not supposed to do. And if you don't, just reach out to our fantastic global travel team or our nurses. Okay. Should you fast before a saline sonogram? Nope, you don't have to. No, you don't. It's a very safe procedure. No, you don't. It's really a fancy schmancy ultrasound is what a saline sonogram is. Manny Love 56 joined us with a little picture of a cat. Hello there. Hi, Sarah. You're welcome, Sarah. Will I ovulate early if I'm not on estrase before a frozen embryo transfer? Yeah, you could. Any suggestions for those that will be doing IVF at CNY long distance? I'm in Delaware and we travel to New York. Oh, yeah. There's a whole travel section in the CNY fertility at the website under the resource page and the family building guide. You will be given lots of instructions regarding optimizing. The best thing is to get really good relationship in Delaware with your doc. There's even a travel packet. Thank you. Christy O'Neill just said there's even a travel packet that you can use, which I recommend. Yeah, I do recommend that. Okay. And join the Facebook groups. There's a travel Facebook groups. That sounds like a great recommendation. I mean, getting support from your fellow travelers is really always a good idea. It's nice to travel with other people, and the Facebook groups, and we have many of them, are really dynamic. What's a travel package? No, travel packet. It's a packet of information about getting to and from our centers all over the country. So we have a whole global travel group. That's all they do. These are nurses, nurse practitioners, whose job it is to make sure that you have what you need to be able to do this successfully. You might be close enough to Philly location for monitoring. So yes, we now have I found out today we have 1,000 centers that help us monitor you folks around the country. So that's pretty darn fantastic as far as I'm concerned. That says an enormous amount of positivity. You know what I mean? So that's something to consider. And then, of course, Atlanta is another office. Sarasota is another one of our centers. And then we have Syracuse, Albany, Rochester, Buffalo, Colorado Springs. I think we'll be expanding and expanding and expanding. It seems like. Okay, Lydia. Lining was 9.2 at Homogeneous Monday. I am in tomorrow. If I'm ready, when would I transfer a day 6? I'm cycle day 12. Well, as soon as you're ready, they'll start your progesterone. 6 days later, you'll put your embryos in. If your beta comes back negative with IVF, is there a possibility that it was a late implant? No, not likely, because that level is very sensitive. I mean, anything's possible, but that level is very sensitive. What is the probability of embryos not surviving after defrosting for FET? Sounds like that's the wrong word. No, defrosting, yeah, that's probably the right word, or warming, or thawing. Thawing is the word you were thinking of, Christy. Pretty much greater than 92%, or sometimes as high as 98% vitrification success rates. So it's pretty darn good. When I was first growing up, we would only expect 50% of our embryos to survive the freeze thaw. If I'm living in North Carolina, what would be the closest CNY clinic for you? I think Atlanta, right? Atlanta, Georgia. But they don't do retrievals there. They could do monitoring there. And then, of course, either Colorado going west or New York going north. All righty. If I need a D&C to thin my endometrial lining, how long must I wait for the retrieval? So there's no association unless you're doing a fresh transfer with the retrieval and the transfer. So you can get the retrievals done and then thin your lining and put them in. Erica, if you beta tested at 25, does that mean that there was a chemical or that? No, that's a real number. That's a real number. Okay. What do you think a low AMH is? What do you think of a low AMH? Mine is 1.6 at 39. Had a hysterectomy. No, that's pretty good, Valerie. That's a very good AMH 1.6 with only one ovary. Yeah, no, I'd like that. You're welcome, Shanika. Thank you. Thanks for your questions. All right, let's get some questions going, young ladies and gentlemen. Low thyroid levels a problem or just high? Yes, low thyroid levels as well as high thyroid. Well, low thyroid levels. If you mean TSH versus free T4, if your free T4 is low, that's a bad thing. Heather, when do you take all the immune 3 medicines? Contact your nurse and she'll give you a calendar and it'll tell you what times you need to do all those, but you have to get started on them prior to your transfer. Alexis Ratchford, do you recommend fresh over frozen transfers? Nope. And how long do you usually stay when you're traveling? If you're doing a day 3, you'll stay that many days. If you're doing a day 5, you'll do that many days. If you're going for the whole thing, it's a 17-day process. What are we looking for my first beta number to be ideal tomorrow? It's just above, it's the range of pregnant. Every lab has a range. You want to make sure that when you get the number, it's not just a number. Serendipity. Okay, I'll ask another. Haha. Only on Omnitro for 2 weeks before stimulation. Is that long enough? Get out of there. Okay. All right. Best protocol for men with no issues during priming time. I don't know what you mean by protocol, Erica. Do you recommend acupuncture before? Absolutely. I recommend acupuncture for retrievals, for transfers, for priming, for reducing miscarriages, for maintaining pregnancies. I do. You folks on Instagram, can you still hear me, or do I have to restart it? I know sometimes. So just tell me if you guys hear me on Instagram. Sometimes when the phone rings, it shuts off my voice thing. When do you check TSH again if transfer is successful? Well, your obstetrician gynecologist. Oop, I got kisses. That must mean it's working. Good. I'm not quite sure your question. When do you check TSH again? There are times throughout the pregnancy if you have a thyroid issue that they'll check. Does male factor affect implantation? Absolutely, Lydia. As does smoking in the male affect miscarriage rates. So even if you don't smoke, if your husband or partner smokes, there is a good chance, or there is a significant chance that you'll be impacted with a higher miscarriage rate. So after FET, how many sessions of acupuncture during the first trimester, second and third? That's something for an acupuncturist to answer for you. And actually, what I think I'm going to do is I'm going to bring on a couple of acupuncturists in the next couple of months to join us and ask questions. I'm going to talk to them next Friday. Macau, I went to another fertility center a year ago and was told my uterine lining is thin. Is there something I can do to make it thicker? Well, it's too general a term to say it's too thin. Acupuncture can help. Estrogen, PRP washes, Hcg washes, good estrogen priming, growth hormone. All of these things can be helpful. Oh, okay, that's what I thought. So I'm going to get out of the Instagram and I'll come back on, guys. Hold on a second, folks. Here we go. All righty. Perfect. Acupuncture is essential. Yes. Sorry about those folks who are on my Instagram. When every time anybody calls me, it disrupts the sound. I hope my sound's back on there, guys. Thank you. Tasha, what medication do you recommend when the free T3 is high and T4 in a normal range while pregnant? Ask your obstetrician gynecologist. I don't do it after the pregnancy part, but yeah, there is a range there and there's a level there. They'll be able to answer that, your OBGYN. Okay, so that would be something CNY would help me with when I can start my own with my GYN. Not sure. Yes, CNY can absolutely help you, Michelle. Absolutely. Is there an acupuncture list for Atlanta? Kaiser doesn't cover it. Yes. Go to the ABORM, the ABORM.org, ABORM.org, put in your address, and you can find a board-certified fertility acupuncturist anywhere. There's about 1,000 of them that Dr. Credenda and I have trained. So you could do that. Sarasota full service yet? Nope. Sarasota is not full service. Sarasota is a monitoring clinic right now. How thick does your uterine lining need to be for an embryo to stick? Well, we like it to be above 6, ideally around 8, 9, or 10, and it can get as high as 17, 18, 19, 20. They don't think there's a high number. There's only a low number. But even that's controversial. Jen, I got an 11 and a 13, but it seems to go higher. Can it go higher than that? Sure, but that's more than enough. What is too thick a lining for transfer? Again, there isn't a too thick. There's only a too thin. Serendipity. I forgot your question about omnitrope. You'll have to come back again with that. Okay. Good. All right, everybody's joining back. Thank you. Sorry about that. My system went down. Well, what happens is when I get a call, it shuts off the sound in my iPad. I've only been on it for 2 weeks before stimulation. Should you continue? Yes. 14 days of omnitrope is the studies have shown is helpful. If you could be on it longer, that's fine, but don't worry if you can't. What do I feel about Hcg boosters? I was asked that question on Facebook just a second ago. I don't. In the old days it was useful. I imagine there may be some use to them, but right now with the progesterone that we have, I'm not so sure. How long should you wait to get an embryo transfer after a hysteroscopy to remove polyps? 6 weeks is what I recommend. What is Pregnal for? Pregnal is your trigger shot. That's what that is. It's human chorionic gonadotropin. It's pregnancy hormone. You use that to trigger. When do we retest TSH if transfer is successful? Again, I think I gave the answer there, which you couldn't hear, which was I would check with your OB to see when they would like to do it, and I'm not sure why you're doing the checking your TSH. Why do you recommend to lower natural killer cells? I don't have a particular thing that I use. What's the growth hormone? Well, growth hormone is something that's as we get older, that's how we grow, but also as you get older, it gets less and less. And a lot of people consider that analogous to aging. And so if the ovary ages, of course, it's not as good. So we can give growth hormone to sort of rejuvenate the ovaries a bit. I don't like that word, but it adds energy to the process. Acupuncture, it's aborm.org, the American Board of Oriental Reproductive Medicine.org. So aborm.org. I'm on Prometrium, progesterone, and oil. Are these the best meds? Yep. They also put Lupron. I thought that was a trigger. Lupron is a trigger, as well as Pregnal. They're both triggers. That's a double trigger. Checking TSH because it was high historically and can be linked to miscarriages. No, I know why you do it, but so you've had problems with hypothyroidism. Is that what you're saying? And so therefore, yeah, they should check it probably within 4 weeks at least, or a couple of weeks of once you get pregnant to see if you're adequately covered. So TSH is high, it means your T4 was too low. Okay, lots of folks coming back in. Thank you. All right, Fresh Mike Stable has joined us. Good. Straight, bad. STR8, the number 8. That's great. Ashio, my pleasure. All righty, how about some questions, guys? We're running out of time here. I've only got a few more minutes left, so any burning questions? So am I supposed to take some sort of other meds after the Prometrium progesterone oil for a trigger shot? Well, there's all kinds of meds that you're on, Jen. So make sure you talk to the nurses, and they'll give you a big list of medications that like immune protocols, etc., antihistamine protocols, acupuncture, serovital, all those great things. If I have high natural killer cells in my uterus, what can I do to stay pregnant? I don't tend to talk about natural killer cells very much because, quite frankly, the American Society for Reproductive Medicine is not sure that information is helpful. Okay. Bird Bash. What kind of coverage are Colorado health plans providing for fertility? I don't know. That's something you have to contact the insurance companies. We haven't even started doing it yet. Can you talk about luteal phase stimming? Well, luteal phase stimming just means you're starting your cycle in the second half of the menstrual cycle. And we learned this from working with cancer patients, that you can start a cycle any time of that 30 days or 28 days and still get eggs. So it's not as ideal, of course, as starting it in the follicular phase rather than the luteal phase. The follicular phase are the first 14 days. Luteal phase typically are the last 14. I have 2 900 IU pens. Would that be enough for what, my dear Heather? It depends on your dosing. It really depends on your dosing. So the nurses can help you calculate. Christy, is there a determining factor that docs use to treat PIO or progesterone suppositories? Christy, the progesterone in oil is the gold standard, for fertility care. It just is. We know you don't like it because it hurts, but it really is the gold standard. Hi, I had 2 miscarriages. One has trisomy 15, the second not sure. Doctor recommends IVF to test the eggs. Yes, I absolutely think that is a good idea. If you can get 2 chromosomally normal embryos, you have about a 50% chance of success. Love the kisses. And if you have 3 chromosomally normal embryos, it's closer to 90%. Bird Bash, will you work with patients that want to try to use their own eggs at 45? Yes, of course. Okay, how do they determine when to transfer the embryo? It's all based on the timing. Is a 200 IU gonal or follistim with Hcg enough, or would that be considered a mini IVF, Erica? Well, yeah, that's kind of a mini dose. Debbie, I have been spotting on and off since November 22nd, but you have to tell me more than that, Debbie. Okay. Should I have treated male factor prior to an IVF cycle? How are you going to treat the male factor, Lydia? Can you explain what Novanoxes do? It's an anti-clotting agent, and sometimes microclots can cause miscarriages in the placenta uterine interface, and that's the thought. How do you give yourself a PIO in the butt? You bend over, or you're flexible. If not, you can do it in the thighs, and the nurses can help you with that. It hurts more, but many people give it in their butts. You kind of reach around. Lydia, I have PCOS and I'm irregular. Would I need to take Provera to start IVF? No. I don't want you to take Provera. I think you could take other things to start progesterone that are better than Provera. You're welcome. You're welcome. So I'm thinking about getting some guests on the show. I may even have a little discussion with Dr. Kiltz on the show, as well as Dr. Fink or Dr. Batterjee, just for fun. You guys can stump the professors. Well, if you have irregular bleeding called spotting, Debbie, K83, then you may need to have your uterus evaluated and ultrasound to see whether or not it's too thick or too thin. And then based on that, we can treat you. There's a video on Facebook for PIO that helped me do my own. There you go, Erica. Thank you. Okay. Sounds like I am signing off here. Yep, I guess I am. Thank you all for joining me today. Does CNY and Syracuse do the genetic testing of the embryos? Well, all of our Colorado and Syracuse, certainly, and Albany can biopsy for the embryo testing, but we don't actually do the testing there. All right, folks, thank you so much for joining me today. Please like us, I guess, on Facebook and Google and all that other stuff. Next week, I think we'll have a topic. I haven't decided which one it is. Is it safe for you to get the COVID vaccine? Absolutely. Please, everyone, breastfeeding women, pregnant women, fertility patients, please have you and your partners get the COVID vaccine. We got to get out of this mess. And all of the data seems to support its safety. So anyway, folks, thank you so much for joining me. As usual, I really enjoyed it. And I'll plan to see you guys next week. I'll come up with some kind of a topic next week and I'll broadcast it early. Anyway, be well, everybody. Thank you. And think pregnant thoughts, okay? Everybody think